A 67-year-old man previously diagnosed with the Hodgkin lymphoma complained of the severe shortness of breath when he walks or climbs stairs. Examination reveals a regular venous pressure of 18 cm water by basilar veils and S3 gallop and 2+ lower extremity edema. His physician suspects an adverse effect of the treatment is causing this patient's symptom. The pharmacological agent most likely responsible for this symptom in this patient has the same mechanism of action as which of the following cancer drug: cisplatin, cyclophosphamide, actinomycin, methotrexate, and paclitaxel. So first, the patient is suffering from Hodgkin lymphoma. Okay, Hodgkin lymphoma, it is a condition of the T cell or B cell tumor. Most commonly it is the T cell cancer. Okay, and in this condition there is a formation of red Steinberg cells. They are like cells which are connected with each other like this. Okay, these are the lymphoma and they have like this, they are connected with each other. This is very specific for the Hodgkin lymphoma, and Hodgkin lymphoma is start from the cervical lymph node involvement, and gradually according to the stages it leads to the progression and involvement of the other lymph nodes. So in till 2 stage it is above the diaphragm, and after that the involvement of the lymph nodes start below the diaphragm, that is the inguinal lymph nodes like this. Okay, so there are a treatment of the Hodgkin lymphoma, that is A, B, DV, BD. ABDV mean A for we can use, these are the medications which are used in case of the Hodgkin lymphoma. A is adriamycin, okay, which is also as a Doxorubocin, bleomycin, vinblastine, and dacarbazine. So from all of the medications, okay, that is the adriamycin, bleomycin, vinblastine, and dacarbazine, one of the medication has an effect on the heart, and which is a very toxic to the heart, that is the Doxorubicin, the class of adriamycin. Okay, so this class of drug, that is Doxorubicin, it is very cardiotoxic medication. It is an antiviral anti-cancer drug which has a cardiotoxic effect. So here in this patient, now start the sign and symptom of the Doxorubicin, that is the bilateral, okay, lower extremities edema, by basilar veils in the lungs, okay, S3 globes. So all these signs shows that there is some abnormality. It is not sure or not confirmed, but we can say after echocardiography or after ECG, after further examinations, we confirm that the diagnosis that the patient having some cardiac abnormalities. So in this case, it may be normally the Doxorubicin caused the destruction of the cardiomyocyte, leading to cardiomyopathy. When the heart muscle cell, okay, they destroy, it leads to the dilation of the heart, so it leads to some sort of cardiomyopathies in this condition. Okay, and for that purpose we need further investigations and further examinations in order to confirm our diagnosis. But this, up till now we can say that the medication which is used in case of Hodgkin lymphoma, there are various kind of medications, as I said. From that, the class of adriamycin, that is Doxorubicin, which has a cardiotoxic effect. It has a cardiotoxic effect. So this drug has some effect on the heart. So what is the mechanism of action? They ask about the mechanism of action. So I want to explain that the mechanism of action of the doxorubicin is directly on the enzyme which is responsible for the cutting of the DNA. Okay, for example, the DNA, during the synthesis of the DNA, at some point it super coiled. Okay, there is abnormal folding of the DNA happen. So there is an enzyme called as topoisomerase 2. The topoisomerase 2 enzyme is responsible for the cutting of this piece of DNA which is abnormally formed. Okay, so in this condition, if this unfold or super coiled or excess folding of this part of the DNA is not cut, then what happened? There is a process of apoptosis. The DNA start to damage because this is abnormal folding. Okay, and apoptosis leads to the destruction of DNA. So doxorubicin, what it do? It inhibit the topoisomerase 2 enzyme. So once this enzyme inhibit, it fail to cut the super coiled or super folded part of the DNA, and once it's not cut it, there is a process of apoptosis, and now this DNA is damaged and destroyed. So it happen in the cancer cell. So it has a very high effect on the cancer cell. So which of the medication here has the same effect as that of the doxorubicin? So definitely that is the Dactinomycin, is a class of adrenomycin. It has the same effect, and that it also what it do, inhibit the topoisomerase, and it act on the DNA. So Dactinomycin is also act on the DNA and inhibit the DNA and help in the destruction of the DNA. Others don't have like that effect. Thank you.